here is I'll start with this graph, which is the figure which shows you the number of cases and deaths in the world so far. Clearly, we are still on an increase in cases, 43 million about now. Note that it took only 15 days to go from 35 to 40 million. It took 38 days to go from 5 to 10 million, showing how fast the pandemic is still going. I was on a call this morning with WHO, and they informed the world that there has been more, that last week there were more than 2 million confirmed cases, and it was the shortest time ever for such an exponential increase since the pandemic began. So in a nutshell, we are probably right now at a day when the pandemic is as bad as it's ever been, with all the intention that it's still going to get worse. The next slide breaks this down now by WHO region. On the left, you have the region, and there's a color code and the number here of cases. And just to go over this very quickly, if you start at the very bottom with the red color, you see that there was way out in February, you get that China blip in Wuhan, and then you see very little red in terms of cases compared to other regions, because the Western Pacific region, including China, New Zealand, Australia, Japan, South Korea, Singapore, are examples of countries that have handled this pandemic very well. You go up to the top of this graph, in yellow, you will see the Americas. Half of those cases are in the US, half are in Latin America. The US has the highest number of cases in the world. In Latin America, we have the most cases in Brazil, Peru, Colombia, Mexico, Argentina, and Chile, with Brazil having the third number of cases in the world. The green color you will see is Europe. And we know that Europe initially had a big curve back earlier in May, in June, in northern Italy, Spain, Russia, which has the fourth highest number of cases, in the UK. But if you look at the green now, you get that sense of a second wave. And indeed, I learned on the call this morning that just about all the countries in Europe are now facing a second wave. In Belgium, they doubled the need for ICU beds in one day. Health systems are overwhelmed. More and more countries are turning to partial or total lockdowns. And I'll talk about the US in a second, but clearly the Northern Hemisphere, which is the US and Europe, are really in for quite a winter. In Southeast Asia, which is in purple, you see there is a peak and it's coming down, and most of that is India. I learned on the call this morning that India has half the number of cases it had a few months ago, and they don't know why. There has been a suggestion of herd immunity in a few areas from so many people being infected, but we really don't know. In the Middle East, you see there in green, and that's mostly been Iran and the Gulf states. The Africa in blue is really interesting, because we don't really understand why Africa hasn't had more of a severe outbreak. It's been bad in South Africa. That's the only country that's really suffered. Africa has had a severe indirect impact in that a number of its other health programs have slowed down because of the fear of COVID. Theories on why Africa has not been severely hit include the young age group of the population. They had some severe lockdowns followed by some strong community responses. Whatever the reasons, it's good news. The next slide shows the regional overview in terms of deaths. I have the next slide. And next slide back, sorry. And here you can see that 75% of the deaths have been in the Americas. You see the yellow color predominating. There's been a decline in the US and in Europe over July and August, but we now are expecting and starting to see a rise as the pandemic spreads in that second wave across the Northern Hemisphere. Overall, there's been a decline in case fatality, and that's because more young people have been infected. We're better at treating the disease, and we're doing more testing, although that's not playing near the role that you might hear on your television set. For example, in the last few weeks, we've had a 23% increase in cases in this country, but only a 2% increase in testing. Next slide. The next slide now, I just want to show you the situation in the US. And this is cases and deaths. And you can see here that we're up now to about, we've had 9 million total cases, 70 to 80,000 daily cases. We've had 230,000 deaths, about 700 daily deaths. But what's really important to look at on the top curve, which Tony Fauci talks about all the time, is the US never got below 25 to 30,000 cases. So some people say we're now starting a third wave. Some people say we're still in our first wave, but you can see here that we have had 3 waves, whatever you want to call it. With deaths, we had quite a bit of deaths in the first phase, but less so now for the reason I already explained. The next slide shows you what's happening by the same graph of cases by geographic region. So in April, we had the hotspots in New York, as Joe mentioned, in Florida, in Louisiana, Detroit. Then in July, we started to see it in other parts of the South, much heavier in Florida, Texas. And then you see in October, we started to see much more in the way of cases in the Midwest. And if I can have the next slide, you will see that if this is last week, the red shows you the high case areas, and the red is rural. So what we're seeing now in this country, clearly, first is much more disease in rural areas. Secondly, a spread now to the mountain areas that haven't had much in the way of cases, the Mountain West and the north central part of the country. North Dakota probably right now has the highest rate per population of cases. And what most people think and are concerned about is that this wave, in contrary to all the other waves, will be national, and it won't be just in 1 or 2 regions of the country. Next slide. And I thought you'd be interested to see this, which is a map showing how different regions of the country have responded to opening up. I mean, the US response has been dismal in many ways, but what I want to show you here is the interesting correlation right now between those parts of the country that have opened up early and now being most severely affected. We'll probably come back to that later. Next slide is another very important characteristic of the response of the epidemic and the pandemic in the US, which Joe, you've mentioned, which is that Black, Latino, Indigenous, and Pacific Islander populations all have considerably higher mortality rates compared to whites. Again, as you said, revealing the great disparities in health status and healthcare in these population groups. Unemployment rates in this country coming out of the pandemic are also highest in African Americans. So that's a quick overview of where we are. Now let me just show you a slide on what has been, next slide, on what has been the characteristic of those countries which have been successful. And these have mostly been in the Western Pacific area and in Asia. Australia gets mentioned a lot, South Korea, which has 50 million people, Vietnam, which has close to 100 million people. It's not just small countries. And these characteristics are leadership, strong leadership, planning at national level, acting quickly, trust in government, and very important, clear messaging and communications. A belief in science and also in new knowledge, the understanding that when new knowledge comes about, here we had 2 important examples, one of them being the fact that asymptomatic carriers could transmit the disease, and also when we became aware of the importance of masks. So believing not only in science, but accepting that science can change and the need to incorporate new knowledge in your science. Very important in Asia, experience with SARS, in Africa, experience with Ebola, adequate supplies of PPE, aggressive use and strategic use, I would add, of testing, contact tracing, quarantine, and isolation, adherence when it's needed to mask wearing and social distancing, and again, as I've shown in the last slide, cautious and opening up the economy. These, if you look as a whole of the countries that have been successful, this is how you would probably, I think most people would say, this has been their main characteristics. Next slide. I just want to finish now by talking about the future. I just want to cover 2 points. One is there's a lot of talk about biomedical interventions bringing us out of this pandemic. And there are 3 types that are mentioned: diagnostics, therapeutics, and vaccines. I'm not going to go these in depth, but with diagnostics, we're going to have a rapid antigen test, hopefully, which will be cheaper, easier to use, quicker, and allow diagnosis to be made much easier. Therapeutics, we've got some antivirals now. Remdesivir, hopefully we'll have more. We have monoclonal antibody made by Regeneron or Lilly, which looks like it will work early, but not late. It could be given in outpatient settings. And later in the disease, we have dexamethasone. A lot of hype about vaccines. Next slide. And what I simply want to point out here is that there are 10 vaccines in phase 3 trials. There are 6 of them that are part of the Operation Warp Speed. You can see them here. They use 3 different platforms. We understand that the ones using mRNA, the Moderna one and the Pfizer one, are likely to have results by the end of this year and may get emergency use to be used, approval for emergency use. Thank goodness the FDA has fought back against the political process to make this decision early. But we're going to have big challenges with a vaccine, first of all, in delivery. And I want to mention that more than anything. What is this vaccine going to do if it's efficacious? Is it going to just decrease severity? Is it going to prevent transmission? Is it going to give us so-called sterilizing immunity? We don't know, and we don't know how long antibody titers will last. We know that in many people that get infected, they only last 3 months. So we have a lot of concerns about how much the vaccine is going to add immediately to our control of the pandemic. Next slide. Really just reminds us then that for me, we need to remember our main, what we call NPIs, which are our what we call non-pharmaceutical interventions. These are well known. I'm not going to read them off, but they are the ones that, this is taken from Tony Fauci's slide recently that he gave as a talk of the key interventions that we have. And as I've already mentioned, they really work when they're applied in the right way. And my next slide, 2 more slides. I just want to finish by saying at a global level, I'm so hopeful that after the election, the U.S. will reestablish its commitment to global health, and where there has been no real success in global health if the U.S. has not participated historically with HIV, with smallpox eradication. We need to cooperate with China. We need to strengthen the World Health Organization, not withdraw from it, and the international health regulations. We need to support the COVAX accelerator, which is helping to get vaccines to low and middle income countries. We need to commit to build back green and green and resilient recovery, addressing poverty and inequalities. And we must accept that global solidarity is essential to control the pandemic. And my last slide, Joe, is to set up our next speakers. That's the curve of cases cases in New York. And you see a little bit of a blip. And there's been a blip in Newark I saw this morning. And so I wonder what our future is going to bring us in New York City. Thank you.